Hi, welcome to October's monthly mini. My name is Val Madsen, and I am the Training and Development Specialist at Respite Association of Wisconsin. Each month we do a monthly mini. It's a short training webinar that lasts 20 to 30 minutes on different topics. If there is a topic that you would like RCAW to explore, please feel free to reach out to us at any time. This month, we are going to be talking about emergency situations during respite care. These are things that you might encounter as you provide respite care in different situations. Emergencies can happen at any time, but what would you know what to do if something did happen? So that is what we are going to talk about and discuss today. First, we're going to start very briefly on talking about illnesses and injuries. We aren't going to go real in depth into this, but just to touch on it before we get into some other situations. So illness, this is something that you really have to take into consideration. And especially now, as we are almost to 2 full years of the pandemic, illness is we've talked about it a lot. And so one thing that you have to think about is what level of sickness are you willing to care for? So looking at someone that, we're hitting that winter months coming up here in Wisconsin. So are you willing to care for someone that has a runny nose, a cough, sore throat, things like that? But then also realize that those might be symptoms of COVID as well. So where do you stand? Where does your agency stand if you are employed through an agency? But then also look, is this normal for this person? So for example, some individuals that use G-tubes, liquid in is liquid out. And so typically diarrhea or loose stools is seen as a situation where the person might be sick or might have a flu bug or a virus going around. But for some individuals, that's their typical norm. And that's just how their body functions. So if it's normal, then it's not necessarily a sickness or illness, but it's when it starts moving away from a person's norm that there should be some concern. So what are you comfortable with? The other side of that is what is the caregivers comfortable with you having yourself? So being very aware of when you have a sore throat, mild fever, runny nose, cough, making sure that you're communicating with the caregivers. They might have some family members that have weakened immune systems or that they're just very cautious about sickness. So just making sure that you have that open communication with caregivers, when and if the care recipient becomes sick during your shift, but then also what your comfort level is along with what the caregiver's comfort level is. Later on, we'll talk a little bit about different COVID procedures and things around that. The other thing I want to touch on just briefly is injuries. So always be aware of your surroundings, but realize that sometimes injuries happen. You want to try to prevent anything you can. So if you notice that, the rug is bumped up or there's other hazards that might cause a fall, using sunscreen. Sunburn is a basic injury, but it can be very painful to care recipients, especially some that are on medications that cause a sun sensitivity. So just do whatever you can to try to prevent those injuries, but things still happen. So again, making sure you have that communication with the caregiver if something does happen. Also highly recommend taking a basic first aid class. It really will provide you a lot of that basic level information around dealing with injuries. Okay, so now let's jump into some emergency situations. So we're going to stay within these 6 categories of different emergency situations. There obviously are things that happen all the time, but these are the ones we're going to discuss today. So emergency evacuations. So this could occur. So this is what happens if you need to leave whatever building you're in. That could be a home, so the care recipient's home or your own home. It could be a building if you're out in the community. Reasons this might happen is a fire, a gas leak, maybe loss of power or water, a threat to the building or occupants, whatever might be going on, you have to leave the building. The biggest thing to remember for emergency evacuations is life is the most important. Things can be replaced. So if there's a fire, get yourself and the care recipient out. That's most important. If possible, whenever you can, try to make sure that any mobility devices come with the care recipient. That might not always be possible. Again, life is your priority. But if the person isn't able to get around, it does take time to get replacements for some of that equipment. So anything you can do, to get a wheelchair, crutches out with the person, that's the ideal situation. But again, making sure that you stay safe and that the care recipient you're caring for is safe as well. Severe weather. Sometimes you might need to take shelter, and that could be because of thunderstorms. And we'll also talk about snowstorms as well, because here in Wisconsin, that can really shut down parts of the state if we do have some of these blizzard warnings. But if you are in the care recipient's home or out in the community, know where you would take shelter if there was severe weather. Where would you go? What would you do? And then where are the items that you would need in a severe weather emergency? Flashlight, snacks, water, something to do for the care recipient. Is there a weather radio or, access to your cell phone? If it's a basement at the care recipient's home and that individual uses a wheelchair, what is the game plan? What do the caregivers want you to do? How do they want you to respond in those situations? Snowstorms are something to be aware of because they have the potential of really stranding people for long periods of time, or at least for longer periods of time than what you might be planning on being at a place for. Also, potential for power loss. And typically with blizzards, if it's really cold, a power loss could be a serious condition. So making sure you have flashlight, blankets, snacks, water, activities, all of those things as well. One thing to really make sure of through all of these situations, but is to stay calm. I've worked with some care recipients that just get really anxious around storms and is continually talking about storms if they know one is coming. So how do you redirect that? How can you help that care recipient stay calm and focus energy on something else? And make sure you're paying attention to the weather ahead of time. Maybe not planning an outing to a park when there's high potential of severe storms or severe weather. So just being aware of that information ahead of time and what's going on in the weather. Another emergency situation that we might see as respite providers is community lockdowns or sheltering in place. So what this means is you might be asked to stay in whatever building or location you're in. Typically, it means to stay in an interior room that has little or no windows, and you're supposed to stay there until an all clear is given. So things that might cause a community to lock down or a police force to have a shelter in place order might be something as simple as a chemical or radiological or hazard outside where it's not safe for you to go outside. I think we saw this when there was a big factory fire just over the border in Illinois, where it was not safe to be outside. So while it wasn't a complete lockdown, they were asking people to shelter in place and not be outside of their home just to reduce the hazards in the air contacting people. Other reasons there might be a lockdown or a shelter in place is there might be a police situation or a violent person in the immediate area, and they will have a community or an area locked down until they have that situation safe. We've seen this recently in the news as well, where there's been police situations and they're asking all area residents to stay in their house until the area is safe to be outside again. If you're in the situation with care recipient, make sure that you follow directions. So if you're out in the community, go wherever they're telling you to go, but then let the family caregiver know where you are and what the situation is and that you guys are safe, just so that they have all the information they need. It might also be a good idea to let your emergency contact know as well, so that they have any information and they know where you are. Someone knows where you are, in addition to the family caregiver. As always, stay calm, and really help keep the care recipient calm. So depending on the situation, it might be important to try to stay as quiet as possible, where in other situations that might not be the case. So trying to redirect whatever is going on, and staying calm and having activities in case to use for distractions. Another is a vehicle accident. Sometimes there's accidents. Maybe you hit a deer, which is a common thing in Wisconsin, or there might be, an accident with another car, whatever it might be. Whether you're in your vehicle or the care recipient's vehicle, make sure that you stay calm. If you're using a care recipient's vehicle, you obviously want to contact the family caregiver right away. You want to follow whatever the insurance company's procedures are for accidents. You also want to make sure to check for injuries on you and the care recipient. Your priority is still caring and making sure the care recipient is safe. So figuring out how to keep that person safe. Is it safer to be in the car, or is that not a safe area? Do we need to get out of the car? Using emergency personnel to help you in that situation so that you can deal with whatever is going on. But again, your priority is that care recipient. If transportation to an ER is needed or by EMTs, make sure that you have the information to give the EMTs about the care recipient so that they are aware of any diagnoses, medications, contact information, the caregiver's information, the client's name, any of those things, especially if you're the one who's injured, and you have to go by ambulance. What happens to that care recipient? What are the next steps? Is the caregiver on their way? What happens? So really making sure, again, stay calm and making sure that everyone is safe, particularly the care recipient, and that everyone is taken care of and the caregivers are on their way to help you out. Another emergency situation might be a lost person. Sometimes individuals that we're caring for might walk away for whatever reason. So one thing to think about is, or to consider, is this might be a normal behavior for that individual. So it's really important to talk to the caregivers. Is this something that happens often? If they do walk away or wander, where do they go? Are they trying to get away? Are they trying to interact with something else? I work with one client right now that really likes to leave her house and go to the neighbors to play with the cat. But she often doesn't ask for that. And so being aware of that, that's a common behavior, something you have to watch. If you do lose the person you're caring for, know what to do. Call the caregivers, call 911, especially if the individual has GPS tracking. Often those are connected to sheriff's departments, but they aren't activated all the time. So once the sheriff department knows what the GPS number is, they're able to activate it and help in that search of the individual. But first, before you do that, check the immediate area. Check the bathrooms, check the kitchen. If you're out in the community, check, what was happening right before that person decided to walk away. That might give you some clues. Were they really anxious or really asking for something or wanted something or saying that they were hungry? That might be a good clue on where to look first. So again, good communication with the caregiver throughout the whole situation. And then medical emergencies is the last big situation we're going to talk about. There's really two types of medical emergencies. For our sake of this mini training, the first is really known conditions. So this might be seizure disorders, allergic reactions, diabetes, but these are things that the caregiver knows that there's a likelihood, whether it's big or small, that this might happen to the care recipient. The other is a sudden medical emergencies that are not expected. So that choking, not breathing, cardiac arrest, heart attacks, things like that, where it's not a planned or something that could happen often. For known medical emergencies, know what the plan is. What is the family's protocol? Is there a seizure plan? And at what point is a seizure med given, if at all? Do the family caregivers want to be called right away? Do they want to be called after 5 minutes? When is 911 called? What happens then? If there's an EpiPen, when do you give that? At what point? And so just being aware of those known medical situations and asking questions to the caregivers and having that open communication. Sudden medical emergencies, obviously, you need to call 911. So call 911, call the caregiver. Make sure you take any information you might need for that care recipient, name, date of birth, medications that they're on, any diagnosis, any contact information for the caregivers, so that they have that on the way to the emergency room, but then also updating the caregivers, this is where we're going, or this is what's happening. We're in the ambulance now, we're heading this direction. Making sure that you stay calm so to help the care recipient stay calm. In some situations, you might be the care recipient's voice, and they're looking to you to help communicate what needs they are having because you know the care recipient better than an EMT. So in all of these situations that we've talked about, the biggest thing as a respite provider, you want to be prepared. So having information about the care recipient with you, when you go out into the community, if you are driving in the car, just having something with you so that you are able to give that to any emergency personnel. Having the caregiver emergency contact information with you so that you're able to contact them whenever you need. Having an activity bag with you. There might be care recipients that really enjoy or use music for calming, maybe fidget toys or squishies. It might be certain books or dolls or animals, different things that help calm the individual down, or things that you guys can do together that will be able to be used as a distraction. Having your emergency contact accessible is really important as well, so that people are able to call for you if something happens to you, they can get in contact with someone. And then making sure when you are on a respite shift, having a fully charged phone so that you can keep up to date with any medical or weather emergencies, community lockdown, shelter in place emergencies, anything like that. So providing respite during the pandemic, this is kind of a challenging time. I know we've been into the pandemic almost 2 years now. So a lot of people are back to providing in-person respite, but not everyone, and the levels keep changing. So different county levels, sickness in some areas or have affected different families. So the National Arch Respite Network and Resource Center created this guide on how to provide respite safely during the pandemic. But then it also goes into some information on things to think about or how to decide for a family or for a respite provider, is it time to do in-person respite again? So for a family, it could be something that you can give them so that they can evaluate, oh, are we ready for in-home respite? Or, oh, we need to take a break from this because the cases are too high. So I highly recommend checking out Arch's website with the pandemic information. It's a really great guide to help give you direction. Last thing we're going to talk about is incident reporting. There are different reporting requirements depending on what your funding source is. If you're paid through an agency, if you are hired by an agency, if you are doing private pay care, so the family caregiver is hiring you themselves. In general, you want to make sure you communicate with the family caregiver whenever something happens. Having this open communication is really key. Sometimes you make a mistake or something happens, someone gets hurt, make sure the caregiver knows. It's also good practice as a respite provider to put things in writing. Oftentimes this is a requirement for some of these agencies or funding sources, but even if you are private pay or volunteer organization, it's always good to put things in writing so that there's a record of what happened. So it doesn't come back on you, or you can say, hey, this is what happened. I wrote this up. This is when I talked to the caregiver. This is what I told them. So then it's in writing. Typically for, the different funding sources for agencies, these are the types of incidences that are required to be reported. So obviously any known or suspected incidences of abuse, neglect, or exploitation, self-neglect, or financial exploitation. So anything like that, it is something that you should report. Death is something that needs to be reported. Significant or substantial damage to the resident of either the care recipient or your residence. Medication errors, treatment or administration of medication without consent, missing person or elopement. So when that lost person we were talking about, unplanned or unapproved involvement of law enforcement, use of isolation, seclusion, or restraint by a provider that is not a part of an approved behavior support plan, or any event or behavior that causes serious injury or risk to the individual. So again, this is a general list. If you're employed by an agency, or if you are employed through a funding source or being paid directly through a funding source, they might have different requirements, but overall, this seems to be pretty encompassing of all of those things. In Wisconsin, there's a couple different ways to report. If you are being paid through CLTS funds, so this is the Children's Waiver Program, there is a link on where to report incidences in different counties, and that's on the DHS website. For any providers that are paid with family care funds, each managed care organization has its own process and form. So that's the agency that you would have to follow their procedures. So when you're hired through an MCO, they'll tell you that this is our process. These are the forms you need to fill out. Oftentimes you can find them on their website as well. If you're paid with, if the respite is paid for using IRIS funds, which again is another adult funding source, there is a form online that you can find also on the DHS website. And all of these situations, no matter what, it's typically you need to report the incident within 24 hours of it happening. So that is just kind of general guidelines and ways to report. So that is all of the information on the emergency situations. If you have any questions, feel free to reach out to me at any point in time. If you have any other ideas for future monthly minis, remember these are topics that should last about 20 to 30 minutes. Feel free to also reach out and give us suggestions. We're always looking for new ideas. Thank you so much for joining us on this month's monthly mini, and we will see you again soon.